What I do want to talk about is a very quick review of chemotherapy and radiation, primarily so that we can understand how and why there's damage to the digestive tract during cancer treatment. And then we'll talk a little bit about the process of toxicities, the type of toxicities. Then I'm going to give you some of my suggestions for nausea and mucositis, which really encompasses the vast majority of the remaining GI toxicities. And this I'm not going to go into in great detail, but this is just a figure for you and your own reference, which basically divides up the types of chemotherapeutic agents that we just briefly mentioned, reiterates the mechanism of action, and then for some of these talks about some of the side effects associated with each of these classes of chemotherapy, and then finally some examples of chemotherapeutics. This is somewhat helpful just when your patient's on chemotherapy. You want to know what type of chemotherapy they're taking so you can anticipate which types of side effects would be most likely to occur, and therefore which systems you should support. So we're knocking off these electrons, and in doing that, we're ionizing molecules in the tumor cells, which will obviously create this chain reaction of direct DNA damage. That's some of the effect. A big portion of the effect is creating these ions within the water that exists within every cell, including tumor cells and tumor tissue. That in turn leads to the formation of these hydroxyl ions, which are very reactive. Those are free radicals, and those directly damage DNA and inhibit the ability of cells to proliferate. Now, of note, healthy tissue is more resistant to the damaging effects of radiation because healthy tissue has more intact cell repair. Their redox balance and potential is higher. They're more oxygenated because their blood supply is more intact, so they can manage these hydroxyl ions to a greater extent than can tumor tissue. And they also have lesser exposure because of the way radiation is delivered to tumors. So from an empirical perspective, I want to put yarrow on your map here, because yarrow, I learned about this actually originally way back when from a patient and started recommending it and have really found it to be indispensable. Yarrow, as we know, is a bitter, but it has a lot of essential oils. And yarrow has some of the same medicinal actions that ginger has. So it has that spasmolytic effect. It has an anxiolytic effect. It's antimicrobial. As I mentioned, it's bitter. It's an antioxidant, anti-inflammatory. So it has enough overlapping actions that we could maybe predict it might do similar things to ginger. And I can tell you that this can be a lifesaver for patients. And in fact, some patients who don't respond to ginger will respond to yarrow. Now, moving down the digestive tract a little bit, there's a specific chemotherapy called irinotecan. It's also referred to as CPT11 and even Camptozar. I know, super confusing. 3 names for the same chemo. But one of the things that happens with irinotecan is that there can be this very severe diarrhea that develops. And this can happen in about a third of the patients getting this chemotherapy. And this is due to a breakdown product of irinotecan, which is called SN38. And what happens is the SN38 is acted upon by bacteria in the intestine into a very reactive metabolite, which actually inflames the intestine and causes diarrhea. A little bit of data on slippery elm specifically. This was a study that compared, interestingly, triphala, which is another interesting combination of herbs for another day, but triphala and slippery elm both, and also licorice actually, specifically altered the microbiome in the gut. So not only are we building that mucosal layer, but really by doing that, we're changing the type of bacteria that reside in the intestines in a way that favors a decreased inflammatory tissue.